Okay, let's jump right into this explainer. We're going to explore the fascinating, almost invisible legal shield that actually keeps our medicines safe. I mean, we completely take it for granted, don't we? You stroll into a pharmacy, hand over a little slip of paper, and walk out with a tiny chemical compound that can literally save your life. But right behind that super simple transaction is a massive, incredibly detailed legal framework. So today, we're unpacking Uganda's National Drug Policy and Authority Act, specifically Chapter 206. Now, this isn't just some dry, boring legal document. It's the literal blueprint for how an entire nation manages, protects, and controls its medicine supply. So, have you ever actually wondered why you can just grab some pills right off a supermarket shelf, but you absolutely need a doctor's signature for others? Well, it's all a massive balancing act. How does a country make sure that life-saving drugs are easily accessible to the people who need them, while at the exact same time making sure dangerous narcotics don't fall into the wrong hands? Chapter 206 of the Act is basically the answer to that exact riddle. It sets up this highly structured universe where literally every single chemical compound meant for humans or animals is categorized, tracked, and tightly controlled, from the second it crosses the border right to the moment it reaches your hands. To make sense of this dense legal document today, we're going to follow a clear path. We'll quickly run through Section 1, the policy, Section 2, the authority, Section 3, drug classifications, Section 4, supply chain rules, and finally wrap up with Section 5, enforcement and penalties. All right, Section 1, the policy. Let's start with the overarching mission here, because before you can actually enforce any rules, you need a guiding philosophy. The policy outlines a few core objectives, stretching from ensuring cost-effective medicines for everyone to actively fighting drug abuse. The very first goal laid out in the Act is to make sure essential, safe, effective, and affordable drugs are actually available to the entire population of Uganda. But, it goes way beyond just having the drugs available. The policy is deeply focused on the rational use of drugs, meaning we don't just want medicines floating around, we want them used correctly by the right people for the exact right reasons. Plus, it legally binds the nation to follow international laws on narcotics and psychotropic substances, making sure Uganda plays its part responsibly on the global healthcare stage. Moving on to Section 2, the authority. Because let's face it, a policy is really just words on paper unless you have a powerful group to bring it to life. Enter the National Drug Authority, or the NDA. They are the primary gatekeepers here. Think of the NDA like the control tower for the entire pharmaceutical industry in Uganda. It's a really diverse body made up of experts from medical associations, veterinary services, the criminal investigation department, and get this, even traditional herbalists. Under Section 5 of the Act, their job is massive. They aren't just popping in to inspect pharmacies, they actually have to calculate exactly how much medication the entire country is going to need so essential supplies don't run out. On top of that, they control all the imports and exports, promote local manufacturing, and act as the ultimate judges of drug quality. Now, standardization is absolutely crucial for the NDA. They mandate that all imported drugs must be known by their generic International Non-Proprietary Name, or INN for short. Section 11 is super clear about this. All drugs imported into Uganda have to be labeled, known, and prescribed by this generic name. So why does that matter to us? Well, imagine your doctor prescribed a drug by a brand name you couldn't find anywhere, but a chemically identical and probably way cheaper generic version was sitting right there on the shelf under a totally different name. By strictly enforcing generic naming, the NDA cuts straight through all that marketing and brand confusion. It guarantees that doctors and patients always know exactly what chemical substance they are dealing with. Okay, Section 3, drug classifications. Let's look at how the NDA manages thousands of different chemicals. Because obviously, a daily chewable vitamin and a highly addictive painkiller can't be treated the same way under the law. Think of these classes exactly like security clearance levels. The first, second, and third schedules of the Act categorize restricted drugs super meticulously. Class A drugs are your heavy-duty narcotics, stuff like morphine and cocaine. These require the absolute highest clearance and can only be imported or used under very strict authority. Next up is Class B, which covers controlled drugs that absolutely 100% require a prescription from a qualified doctor, dentist, or vet. Then we have Class C. These are licensed drugs that can be sold by retail, but, and this is a big but, still only by someone operating a properly licensed pharmacy or a licensed drug seller. It's a highly structured system designed to keep the most dangerous substances totally locked down. And the Act leaves zero room for loopholes here. This specific quote from Section 12 is a fascinating legal failsafe. The lawmakers knew that drug preparations can be really complex, right? Sometimes you have a mix of ingredients that might technically fall into a few different classifications. To make sure no one skirts the rules, the law defaults to maximum security. So if there is even a tiny drop of a Class A narcotic inside a mixture that otherwise looks perfectly fine as a Class C drug, bam, the entire mixture is automatically treated as a Class A drug. No exceptions, no gray areas at all. Which brings us to Section 4, Supply Chain Rules. Now that we understand the classes, we need to see who is actually allowed to handle these substances out in the real world. Because a drug is really only as safe as the hands it passes through, right? The Act is actually incredibly pragmatic about this. It makes a strict distinction between a licensed person and a licensed seller. Ideally, we'd all want a fully qualified pharmacist overseeing every single transaction, but in rural or underserved areas, that's just not realistic. So Section 14 outlines the licensed person, usually a business directly supervised by a resident pharmacist who is fully cleared for Class A, B, and C drugs. But then Section 15 introduces the licensed seller. If an area doesn't have any existing pharmacies, a non-pharmacist can be licensed to sell drugs, but they are strictly limited to Class C drugs only. It is a really smart way to balance public safety with the urgent need for medical accessibility. And dispensing restricted drugs involves this completely unbreakable protocol. When a pharmacist hands over a Class A or B drug, they aren't just ringing up a quick sale at the register. Under Section 20, they first have to verify that the prescription is written in indelible ink, meaning it can't be erased, and that it's dated and signed by a qualified practitioner. But the paperwork doesn't even stop there. Section 24 requires them to meticulously log the transaction in a specific classified drugs book. They have to record the patient's name, the exact drug quantity, the purpose, and even grab the recipient's signature. And get this, all these records must be kept on the premises for 2 full years, ready for inspection at literally a moment's notice. Which leads us perfectly into our final stop, Section 5, Enforcement and Penalties. After all, a protective shield is completely useless if it doesn't have any teeth. Part 7 of the Act grants drug inspectors and high-ranking police officers some seriously sweeping powers to ensure compliance. If they even suspect an offense is happening, they don't just have the right to casually pop into registered pharmacies during normal business hours. No, they can enter suspected premises or flag down and search suspect vehicles and vessels at absolutely any time. They can demand information on the spot, and most importantly, they can seize any drugs or records immediately. If a drug is suspected of being impure, adulterated, or even just deteriorated, it gets yanked from the supply chain right then and there. And what happens if you break those rules? Well, Section 30 is where the law really brings the hammer down. If a person supplies unwholesome or impure drugs, basically selling something that doesn't meet authorized standards or is adulterated, they face severe penalties. We're talking fines of up to 5 million shillings. That is a massive financial deterrent for anyone who might be tempted to cut corners in the manufacturing or supply chain. The message here is crystal clear. Playing games with public health is going to cost you dearly. And it certainly doesn't stop at just fines. For severe or repeat offenses involving international narcotics, Section 60 states things can escalate fast. Even just manufacturing, smoking, or simply possessing certain narcotics can land you in prison for up to 10 years for repeat offenses. And for the worst cases involving drugs under international control, it can even go up to life imprisonment. The Act makes sure the punishment accurately reflects the massive danger that unregulated drugs pose to society. This legal shield we've been talking about, it is heavy, and it is built to severely punish anyone who tries to break it. So as we wrap up this explainer, I really want to leave you with a thought to chew on. How does this invisible regulatory shield impact your own health choices and safety every single time you visit a pharmacy? The next time you walk in to drop off a prescription or even just buy a basic painkiller, take a second to remember the immense, quiet machinery of the National Drug Authority working right behind the scenes. Think about the careful security classifications, the strict generic naming rules, that meticulous classified drugs book, and the inspectors ensuring everything is pure. It's an incredibly controlled ecosystem operating right under our noses, just to guarantee that the medicine you trust to heal you is exactly what it claims to be.